So if you're going to work with the spinal cord from head to tail, that whole dural membrane that you can see in the Netter's anatomy book that attaches right behind the eyes, right at the foramen magnum, right at cervical number 2, actually 3, I think. A lot of people have dural attachments of the vertebral column right here behind the heart area and adrenals at the diaphragm. So tracking all the way down as if you had a bowling ball pulling on your tailbone. So you can imagine if you're trying to release the sinuses up here and there's a locking of the fascia down here because of a tailbone injury, some colon issue, appendix issue, L5 injury, depending on how old your client is. The sacrum's right under here. She's a little cold, but I'll show you real quick. You're gonna be kind of, this is L5. You know, you're gonna wanna be right on the sacrum. So you're gonna, I don't bother with the two hands like front and back with this because it's kind of awkward for the people, but what you can do, you're gonna find your depth, so go past the pants. You're looking really to be kind of in that springy tissue of the muscle fascia right here. You're not going to slide your hands, you're gonna anchor, and you're gonna pull down and up. So you're gonna go into ease, remember. So depth. I use this top hand just to stabilize, otherwise it gets kind of hard to hold this for a long period of time. Tissue depth of the sacrum, fascia around there, looking at the Netter's anatomy, maybe have the book right over here so you can look at all the nerve roots coming out of the sacrum so you can be very intentional about your fulcrums. Find your depth, you glide up, neutral, down. So it's easier for me on this person to glide down. Up has more tension. You can kind of pay attention to where it feels kind of low, where you get your tension. Now you can go toward that wall and towards yourself. Gliding toward myself has a lot more resistance than going toward the wall. So far the two easy ways we have are up and to the wall. From there, you can test clockwise, counterclockwise. This way is easier, so clockwise. So we have clockwise, toward the wall, and up. And now you're not gonna go as hard as you can. You wanna go about, just like a nice conversation. You're not being pushy, right there. And then I would hold here. I would lay down an anchor and hold this. This hand just makes it easier to relax and treat from your heart. Finding the ground underneath your own body. And I'm gonna cover her up so she can relax and be warm. So you might stay here for 10 or so minutes. I'm actually gonna do that right now because I have my daughter here in braces. We just started orthodontia. And when you rearrange the face and the maxilla, you address changes in the cranial base and the spinal cord as well. So I'm gonna hold this for about 10 minutes. Indications for the sacrum release, even if you're not doing cranial sacral release. This helps with people with pelvic floor dysfunction, tailbone pain, so coccydynia, pudendal neuralgia, anything that's coming from L5, S1, sciatica, osteoporosis, bone tenderness. You're opening up this fascia, opens up the circulation and the space for the nerve roots to come out of the sacrum and then travel down the legs. So pelvic floor, pudendal neuralgia, sciatic, Achilles issues, freeing up the tissue here. If it's puckered up toward the sacrum, if you free that up, it only allows this to have more space. So for toe walking kids, Achilles tendons, plantar fasciitis, sciatica, and then it's kind of nice there's a blanket here, right? Because if it was tethering up here, you could see it would pull all the way up to her cranial base. So that's part of why I like to start with the sacrum first. You're not going into the body like a bull in a china cabinet. It's very easy to feel here. If you don't feel like restrictions very obvious one direction or the other, just stick with one or two. You know, you're doing a really nice release for somebody even if you just find one plane that's easier, like down is easier, right, and holding that. But you free up this tether that's pulling all the way up to the brain. The body's gonna guard this a heck of a lot more than this. So you would open this up before you try to mobilize the cranium. Remove the bowling ball, get a little bit more fascial release through the whole spinal cord, that fluid in the cerebral spinal fluid, space, mechanical pressures around the discs. If you are treating somebody with pudendal neuralgia or sciatic pain, it's very normal to, and actually she might be actually getting a little bit of a sensation at L5. I feel kind of a buzzing at L5. If your client or your child gets referred tingling or pain down the leg, that's actually means that you're on something. It's a bit like picking a sticker off of something. So as it's coming off and getting more space, it is stimulating. Not really ever has it happened that when I have something unwinding from fascial release, does someone get a sensation that they've never had before. So when you get that fascial somatic story opening up around the sacrum, fascial release down the leg, you want to wait until you feel, if your hands aren't trained to feel that let go, it kind of pushes away and floats off nicely. When you're done with a fascial release cycle, you can just check in with your client and see, often the sciatic pain will ramp up, or they'll get bowel cramps or uterine cramps. That will ramp up and then it will settle down. So you want to wait if they can. Sometimes I've had to, as a patient myself, had to have people give me a break on an area that I had a lot of scar tissue on. But ideally you could let that ride, not pushing and shoving, not trying to get them to, tell you to stop. Obviously utilizing those, please stop, it's uncomfortable. But if it's me experiencing this as a patient, I just try to watch the story and listen to the story, let it unfold, and often then that uptick that you get of symptoms will then disperse after the release. So another place that you can unwind is a three-planar fascial release to the shins. If you're thinking about this blanket analogy, also when kids or adults go through a growth spurt and they have tight Achilles tendons, also if the fascia is anchoring down here around all those neural tissue, you're going to have a more hyper agitated nervous system by this mechanical tension at the shins. The shins being the carpal tunnel of the legs, it's going to also pull to this. And then they'll have a conversation of like, let me limit lumbar mobility because this is pulling too hard. So for the people that have really tight hamstrings, that durally straight leg raise, I would do as a protocol sacrum three-planar myofascial release. I would release both shins, indirect three-planar fascial release, maybe 10 minutes. If your hands don't feel anything yet, hold 10 minutes, 10 minutes, 10 minutes. And then use the strain counter strain video for the adductor, the groin muscle, the hamstring, and the gastrocs. That completely unloads the whole lower legs for people that have anterior compartment syndrome, shin splints, growing pains, sciatic, poor blood flow to the feet, lumbar pain, all that. So this looks like a pretty good. Are you getting any tingling or anything?
A little bit.
Do you feel anything?
Not really.
Okay. So I felt an unwinding right there at the PSIS and sacral base. Okay, so then when you're ready, then you can just kind of let go and let them move around. So for sinus to tailbone perspective, this is a good place to start. Unload the sacrum, unload the shins, unload the Achilles, and then head up toward the head and neck. Because if this is tethered down and you're asking this to let go while this is still pulling, this isn't going to likely let go. Or you release here if this has a real strong tether on it and it makes them more uncomfortable to release an area without releasing first this anchor. People that have had significant concussions, soccer balls, competitive springboard diving, anything that's banging the top of the head, difficult deliveries, you would want to definitely start with the sacrum first and also participate in some neurofascial processing. Wherever that person hit their head, the frontal or the top of the head, parietals, you can hold that to the sacrum for 10 minutes. Whether you do a sacrum release and that comes up, it's always good to sit if you have Reiki skills or any other sort of somatic skills. After you do a sacral release, do 10-minute hold, neutral hold, not a three-panel fascial release, just a neutral hold of connecting the top of the head to the sacrum for integration. As your hands get more trained, you can really start to feel around and see like, okay, it doesn't connect as well there. It's more right on the top of the head. I feel this is a sort of magnetic, zoomy connection to the whole sacrum. Let me see the other side of your head. Yeah, so for her, it's straight up top of the head. And let me check frontals. If you get like that deer in the headlight look, the other place that you can do is right between the eyes. Take your hand and just gently cover the eyes and let that kind of dance that out, neurofascial process or frontals. And you're just kind of looking for this kind of oscillating, I call it a floating dock energy that happens between the top of the head, the sacrum, in between the eyes and the sacrum. And you're looking for that dance and then to let go. If you have two magnets in a connection in the body, you don't want them staring at each other in some sort of over facilitated way, and you also don't want them being like, talk to the hand, I'm not talking to you. So don't assume if you put your hand on the sacrum and hand on the top of the head, if you feel that like deer in headlights push away, I'm not even talking to you, just wait there for 10 minutes until it starts to talk and then disperse.
Like when I had the flu, I stared.
Yeah, if there's going to be a viral load, often the body's not going to let that go until that viral load is gone. So if somebody has an active infection, that isn't the time to do a fascial release. You want to wait until the body has a sense of safety before you try to ask it to compensate. If somebody's in an active infection, you can take that area of infection, say it's the sinuses, and do some neurofascial process to the spleen and the liver, the adrenals, and lymph nodes. Any area of main lymph you can take to infection. Just doing that hand listening dance. You wouldn't do the fascial fulcrum when somebody's actually sick or just hurt themselves. If they just hurt themselves, if they just hit their head, all you're doing, find the place they hit their head after you do the ice and the doctor and the ER if you needed to, and you could just connect energetically. Neurofascial process, acute. Also chronic, because you could do that on your own self.
I can't see your face.
Okay, and then on the they don't care about my face. And then on the next segment, we'll go into, the detailed unwinding. Always easiest and best while you first practice to do indirect techniques, meaning into ease, before you drop into the bones and start asking it to go places that it doesn't like, which is direct techniques. So see you in the next video.
Bye.
Bye.